think so.
Go ahead.
Hello, everybody, and welcome to another episode of Misfit History. It's funny because this episode is mostly apocryphal. The whole reason I chose to do it probably is something that never happened, but the story of it was so interesting that I wanted to talk about it. We're going to be talking about a surgeon named Robert Liston. And his life was interesting. He was very important. But there's one particular thing about his life that makes it worth talking about. Now, in surgeries, there's a mortality rate associated with different surgeries, right? If I do a surgery 10 different times, the same surgery on 10 people that need it, and 7 of them die, one, probably not a great surgery for me to be doing. And we would say that surgery has a 70% mortality rate. But Robert Liston performed a surgery that apparently has a 300% mortality rate.
How is that possible?
We'll get into it.
That's awful that it got to that point that they even know that.
And the funny thing is, Robert Liston was not a bad surgeon.
Really?
Surgeries just used to be tough back in the day.
Yeah.
So, Robert Liston was born on October 28th, 1794, in Ecclesmachen. He was the son of Margaret and her husband, who was a reverend, Henry Liston, a clergyman who also happened to be an inventor. They were all west of Edinburgh in Scotland. His grandfather, also named Robert Liston, was moderator of the General Assembly of the Church of Scotland. Pretty big, pretty important family in the local area. Yeah. Yeah. He received an education from his father and in a village school nearby, and then started studying at Edinburgh Medical School in 1808, which, if you're doing the math, means when he was 14 years old, he started med school.
Oh, wow.
Yeah, he was a sharp fellow. And in 1810, he became an assistant to Dr. John Barclay. And in 1816, he went to London for a year to train under William Blizzard. He returned to Edinburgh to teach anatomy after that, which, again, if you're doing the math, means he was 22 years old when he began teaching anatomy.
Oh, wow.
That's pretty young.
In 1820, he married the daughter of Adam Crawford. And in typical 1820 fashion, we know her father's name. We do not know her name. So, in 1818, a little before his marriage, he had become a house surgeon in the Royal Infirmary under Dr. George Bell. And then he had a disagreement with Dr. Bell, and he got dismissed in 1822 and wasn't allowed to come back for 5 years.
Oh, wow.
He came back and was promoted to operating surgeon immediately.
Oh, wow.
He became first the Northern Anatomist of Blackwood's magazine, and in 1832 to 1833 he lived in 99 George Street in the center of Edinburgh's New Town. He tried to become a professor of anatomy there, but got beaten by a guy who was 5 years younger than him, who reportedly showed much better aptitude for teaching. Liston left Edinburgh and relocated to London after that. Now, the thing was, Liston was not the best at teaching, but what he was great at was doing surgeries. He became called the fastest knife in the West End.
Oh.
Now, we've talked about people from the Wild West, and we want them to be the fastest gun blankety-blank town. I don't know if you want your surgeon to be the fastest knife.
Yeah.
But back then, it was actually very important because something wasn't invented until a few years into his career. Anesthesia was not discovered and utilized until later in his career.
Oh.
So you really want your surgeon to be quick.
Yeah.
Yeah.
And Liston was very
Real quick.
Liston could reportedly amputate a leg in 2.5 minutes.
That's easy.
Yeah.
Just use a chainsaw.
He is reputed to have been able to complete operations in a matter of seconds. At a time when speed was essential to reduce pain and improve the odds of survival in a patient. This was pre-Lister, who we will definitely do an episode on in the future. Not to mix up Liston and Lister, Joseph Lister, very famous for his antiseptic and theory of microorganisms and things like that. So we'll discuss him at a time in the future, but basically they didn't know anything about being clean at this time. So going quick might as well go quick.
Yeah.
If you're not going to be clean and precise, you might as well just be fast.
Yeah.
Florence Nightingale, who also we're doing an episode on in the future, had a book she wrote called Notes on Nursing. And in it, she stated, there are many physical operations where, ceteris paribus, all else being equal, the danger is a direct ratio to the time the operation lasts. So basically, the faster you go, the safer your surgery will be.
Yeah.
Don't know how they came up with that idea, but it was an idea, and Liston believed in it wholeheartedly. And this is a description of what he looked like as a surgeon. He was 6'2" and operated in a bottle green coat with Wellington boots. He sprung across blood-stained boards upon his swooning, sweating, strapped-down patients like a duelist, calling, "Time me, gentlemen, time me," to students who assembled to watch him. They were craning with pocket watches from the iron-railinged galleries. Everyone swore that the first flash of his knife was followed so swiftly by the rasp of saw on bone that sight and sound seemed simultaneous. To free both hands, he would hold the bloody knife between his teeth while he sawed away at the bones.
Bruh.
Again, they didn't know anything about keeping wounds clean. So he was in a room with multiple patients and would go patient to patient using the same knife and saw. And to keep his hands free, he would hold the knife in his teeth while he was using the saw.
That's disgusting.
So, Dr. Oliver Wendell Holmes, who might also get an episode in the future. There's a lot of really interesting people in early medicine. At an address by Dr. Oliver Wendell Holmes to the Boston Society for Medical Improvement in 1843, his suggestions for hygiene improvement so outraged physicians, particularly in Philadelphia, that they would chase him out of the room when he presented. So they did not like the idea of improving hygiene because
crazy.
Part of it was doctors, and there's another one named Ignaz Semmelweis who we are doing an episode on. I know because I already wrote it. Doctors, they were so hated. They hated the idea that they might be responsible for their patients having issues. So if it was like you weren't clean enough when you did a surgery, the doctors were like, "Me, I'm not dirty. Like, look at these people with coal on their face. They're dirty," not realizing that like touching one person and then touching someone with an open wound could be way more dangerous than having coal dust in the area. Not that coal dust in a surgical theater is also a good option, but in those days, the idea was surgeons would operate in blood-stiffened coats. They would be covered so much in blood that the stiffer the coat, the prouder the surgeon was, because it meant they were busy. And pus was as inseparable from surgery as blood, which is just very gross to think about.
Yeah.
He said cleanliness was next to prudishness. There was no object in being clean. Indeed, cleanliness was out of place. It was considered to be finicking and affected. An executioner might as well manicure his nails before chopping off a head. So, yes, surgeons compared themselves to executioners too. The connection between surgical hygiene, infection, and maternal mortality rates was only figured out in 1847 by Ignaz Semmelweis, who we're going to discuss, like I said, in a different episode. After one of his colleagues died due to the cross-contamination, he instituted the hygiene practices that Holmes had been preaching about, and mortality rate fell. But that was in 1847. The era that Liston lived in was the bloodier the coat, the better the surgeon. And Liston was an abrupt, abrasive, argumentative man, unfailingly charitable to the poor and tender to the sick, which was vilely unpopular to his fellow surgeons. He relished operating successfully in reeking tenements and dirty conditions on patients that had been discharged as hopelessly incurable. So he's a pretty nice guy.
Yeah.
And so the other surgeons in the Edinburgh Royal Infirmary conspired to bar him from the wards, banished him, and made him go to University College Hospital. Luckily for him, he made a fortune there. Mostly because he could get through a lot of surgeries in a day.
Yeah.
So he's portrayed as a man of strong character and ethics in his like historical biography, but some of those we don't really know like how many of the sources are there. But famously, he confronted a medical colleague, Dr. Robert Knox, who, if you've ever heard of the Burke and Hare murders and grave robberies, Dr. Knox was involved. He was the guy one of the doctors buying bodies from Burke and Hare. And Mary Patterson, who it later transpired had been murdered, her body was treated in such a way by Dr. Knox that Dr. Liston confronted him over it. She was in Knox's dissecting rooms within 4 hours of her death, which Liston thought very suspicious. Wow. And then she was preserved in whiskey for 3 months before dissection, before like her full dissection, and was basically a voyeuristic display that Knox kept around for him and his students to look at and laugh. And Liston wrote a letter to Knox and then wrote a letter to verify that he had written a letter to Knox. So he was very opposed to this. He suspected foul play and then went into a lecture that Knox was teaching and knocked him down. So Liston was cool.
Yeah.
He had pioneering contributions. He became the first ever surgeon to have an operation utilizing anesthesia on the 21st of December in 1846. So the problem was Liston would never be remembered for all of his many accomplishments. He invented many things. He invented see-through sticking plaster. He invented a type of forceps used in surgery. He had two very famous students, Joseph Lister, who became the pioneer of aseptic technique, like discussed, James Simpson, who became the pioneer of chloroform as an anesthetic.
Mm-hmm.
But he's only remembered for one singular surgery he performed. It was a leg amputation, which he was very famous for. And he had an assistant who had to hold down the screaming patient because surgeries hurt.
Wow, yeah.
No kidding. And he had spectators gather close nearby. You can see how close some of them are standing, because they wanted to see his masterful technique. And they'd heard he's fast, but they didn't know how fast the fastest knife in West End is. And upon prepping his very sharp, very large scalpel, Liston performed his surgery so quickly that he cut through the patient's leg as he was supposed to. Unfortunately, he also cut off his assistant's fingers or hand and also sliced through the coattails of one of his observers, who was sprayed with blood and, seeing that his coattails had been sliced, fell down and died from shock. And both the patient and the assistant died of gangrene a few weeks later, giving him a 300% mortality rate on his surgery.
Oh my goodness. Definitely not what I was expecting.
For the last 7 years of his life, he lived at 5th Clifford Street off Bond Street in Mayfair. He had been elected a Fellow of the Royal Society in 1841 and died of an aortic aneurysm in 7th of December 1847 at his Mayfair home. His funeral took place 6 days later. The funeral procession from his home consisted of 5 coaches and 15 private carriages. He had relatives, his fellow medical professors, and friends of eminence in the higher ranks of society. His funeral parade was met by more than 400 people he had taught and more than 200 medical practitioners. Following his death, meetings were held that decided to establish a lasting legacy to him, including a medal that was given out called the Liston Medal every year. Again, that is unfortunately not the most famous part of his legacy. And that is the end of our story about Robert Liston. What did you guys learn?
I'm happy for modern medicine that it's not like that anymore.
Yeah.
Do you guys think it actually happened? There's basically, most people think it probably didn't because it's just such an absurd story. Do you think he actually managed to kill 3 people in one surgery?
Well, I mean, how would... Like, I understand him cutting fast, but it's not like he was using, like, a power tool to cut through this guy. So I don't understand how he could have cut so fast that he cut the finger off of.
So that is true. I will have to let you. I'll cut you. Or that's a weird thing to say. We'll get a scalpel. I have scalpels. I'll let you cut something with them. They are sharp.
Really?
Like, yeah, unbelievably.
But cutting through a whole like bone.
I'll let you see. We'll cut something with them.
Okay.
That would be cool.
My
actually.
hands hurt just thinking about
Yeah, like whoosh, but no, it almost definitely didn't happen. But it's also just so funny to think about. Yeah. Well, hopefully you enjoyed this special, I guess, episode of Misfit History. If you did, check out our other episodes and leave a like and a comment and stuff like that. See you next week.
And if you're wondering about the Burke and Hare episode, we never posted it.
We did not.
It was not worthy of.
It was
the
definitely
internet.
About 7 of our episodes we've already posted weren't worthy of being posted. This one was worse.
Yeah. Well, now you. Okay, Moses was a puppy, and he may or may not have. We were using headphones, and he chewed through some headphones.
Also, our studio setup did not make for a good conversational aspect.
And it was really quiet in your headphones when you were talking. Or no, it was really loud. That's what it was. So you were like whispering at the mic.
And we were also...
ASMR.
Yeah, we were also chewing louder than we were talking.
Yeah.
Popcorn, not a great podcast.
Maybe we'll post that one on like a Patreon someday.
Yeah. Dude, once we get enough viewers, it wouldn't. No, probably not. I think we should actually move all of the season 0 to Patreon.
Later.
No one's seen them.
Yeah. Only a couple people have ever
Only a couple people. You are in the select elite few. Grandma.
Okay,
See you
we
next
gotta
week.
be done.
Yeah.